Achondroplasia. Achondroplasia is no doubt the most common form of dwarfism. It is caused by a genetic mutation that affects the growth of bones, and this only affects about 1 in 27,500 people. You can spot this rare disease when you see signs like short fingers and toes, a large head, and sometimes bow-leg deformity. People with achondroplasia are prone to having challenges moving around, and the scary part is that this condition can be passed on to the next generation. Moebius Syndrome. Moebius Syndrome is a rare condition that affects the muscle controlling facial expressions and eye movement. Never mistake people with this condition for being dull and unfriendly just because they usually do not smile or move their eyes sideways. That's not their fault. Blame Moebius Syndrome. It also comes with other symptoms like crossed eyes, difficulty breathing, and delayed speech, but it does not affect their intelligence and mental alertness in any way. Gaucher Disease. Gaucher disease is caused by a hereditary deficiency of an enzyme called glucocerebrosidase, which causes fatty substances to pile up in the liver, spleen, and bones. This disease often results in bone pain, excessive fatigue, anemia, and an enlarged liver. However, in some cases, some yellowish-brown skin pigmentation can surface. Affected persons only stand a chance to overcome this condition with enzyme replacement therapy. Maple syrup urine disease. Maple syrup urine disease, or MSUD, is a metabolic disorder that affects babies. It is caused by a genetic mutation that affects the normal breakdown of specific amino acids. Usually, the result is a sweet-smelling urine that appears like maple syrup. It can lead to both poor feeding and slow development, coupled with lethargy, irritability, and intermittent seizures. Erdheim-Chester disease. Erdheim-Chester disease, ECD, is an extremely rare disease that affects the body tissues and is caused by the abnormal growth of some cells that infiltrate organs like the skin, kidney, lungs, and brain. ECD patients generally show symptoms of bone pain in their ankles, knees, and lower limbs. Although the pain may be mild, it's somewhat permanent. Paraneoplastic Pemphigus. Paraneoplastic Pemphigus, PNP, is a mix of skin disease and cancer. It is quite an uncommon condition caused by an underlying tumor in the body, and it has a very high mortality rate of about 90%. Usually, affected individuals might be ignorant of the condition, as PNP manifests as painful blisters and sores on the skin. So it's easy to conclude it to be just another skin issue. Cystic Fibrosis. Cystic fibrosis is a genetic disorder that affects the respiratory and digestive system. The real cause is the shortage of a specific protein traceable to a faulty gene, which in turn results in the accumulation of thick, sticky mucus in the lungs and digestive tract. When this happens, an individual begins to experience breathing issues, coupled with frequent lung infections and digestive problems, which can end up in poor weight gain. The worst thing is, there is no known cure for this condition. It can only be managed. Wilson's disease. Wilson's disease is a genetic disorder caused by the buildup of excess copper in the body. You see, there is a limit to how much copper the body can hold, so when it's getting too much, the body transports it into the bile so it can be excreted. If not, copper will begin to accumulate in various organs like the brain and liver. This can end up in kidney problems, liver disease or failure, intense weakness, and also psychological issues. Primary ciliary dyskinesia. Primary ciliary dyskinesia, or PCD for short, is a very rare and complex disease. It is traceable to the genetic mutation that affects the functions of some tiny hair-like structures known as cilia. The malfunctioning of cilia is degenerative to the body, as it can result in respiratory infections, deafness, and even the inability to conceive in women. Some of the symptoms include difficulty breathing, especially at the early stage. As time goes on, affected persons may begin to experience severe runny nose and a chronic cough that produces mucus. Angelman Syndrome. Angelman Syndrome is somewhat a paradoxical rare condition. It comes with the challenges of a medical problem and also the seemingly joyful atmosphere that follows it. Let me explain. Angelman Syndrome usually affects children and is caused by a genetic mutation that affects the function of a gene in the brain. This results in stunted development of the child and also intellectual disabilities and inability to speak well. Ironically, children with this condition also possess contagious laughter that can light up any room. That also comes with a symptom package. Angelman Syndrome has no known cure, but the happy atmosphere that affected persons radiate seem to give them the energy to cope with and manage it. Fish Odor Syndrome. Fish Odor Syndrome, scientifically known as trimethylaminuria, is a distinct metabolic disorder that causes the affected person's body fluids to emit a strong fishy odor. Here's how that happens. A genetic mutation occurs, which affects the body's ability to break down a compound called trimethylamine. As it builds up, it is released into the sweat, breath, urine, giving off a strong, offensive fishy odor. However, this odor is most notable in the urine, which comes at quick intervals. Progeria Syndrome. Progeria Syndrome is one of the most feared rare diseases. First, a gene known as lamin A, which is responsible for making proteins hold the cell nucleus together, gets mutated, and then an abnormal formation of lamin A occurs, which results in individuals, mostly children, appearing older than they actually are. Children with progeria often show symptoms of stunted growth, wrinkled skin, hair loss, and weak bones. If not well managed, progeria can result in cardiovascular problems, and even when proper medical supervision is in place, progeria patients typically do not live beyond their mid-teens to early 20s. Tourette Syndrome. Tourette Syndrome is a neurological condition that begins in the childhood or adolescent stage of individuals. It is caused by a combination of genetic and environmental factors, which affect the communication pathway of the brain. Individuals with this condition often experience involuntary movements and vocalizations called tics. Some of them are blinking, coughing, clearing their throat, and random facial movements. The bottom line is that they do not want to do these things, but they can't help it. So do not mock an individual with this condition if you encounter one. Muscular Dystrophy. Muscular dystrophy is a group of disorders that affects the muscles. The disorders differ depending on which muscle are primarily affected. It occurs in some individuals because of dystrophin, a group of proteins essential for strengthening the muscles, is genetically mutated, thereby leading to the weakness and loss of muscles over some time. Major symptoms exhibited include weak muscles, respiratory difficulty, calf deformation, and limitation in range of movement. Currently, there is no cure for this condition, but with adequate medical supervision, affected individuals can live a normal life. Stiff Person Syndrome. Stiff Person Syndrome is one of the rare medical conditions with absolutely no traceable cause. Individuals with this condition are known to struggle with moving around as their muscles progressively become rigid and stiff. It becomes increasingly difficult for people with this syndrome to lead a normal life because they cannot predict or determine when their muscles will fail them. They mostly experience symptoms of chronic muscle pains, intermittent spasms, and difficult movement. Wolfram Syndrome. Wolfram Syndrome is caused by mutations in the WFS1 gene, which results in the degeneration and dysfunction of different organs. The scary thing about this condition is that its symptoms are complex and problematic. They include diabetes mellitus, hearing loss, sight defects, and sometimes neurological problems. Individuals with this condition have to face the pain of dealing with several medical conditions at a time. Prader-Willi Syndrome. Prader-Willi Syndrome is a complex genetic disorder that occurs as a result of either the absence or dysfunction of certain genes on chromosome 15. This disorder can reveal itself in a range of challenges, including behavioral difficulties, difficulty breathing, excessive sleeping, crossed eyes, and insatiable hunger. Yeah, folks with this condition tend to eat a lot, so much so that their feeding mode may be mistaken for gluttony. But hey, it's the condition. Pompe Disease. Pompe disease is so spectacular among rare diseases. Individuals suffering from this disease often experience signs of weakness in their muscles. They also have cardiac complications and usually find it difficult to breathe steadily. This is because they are deficient in an enzyme known as acid alpha-glucosidase. This deficiency is responsible for the accumulation of glycogen in their muscles and different body tissues. Brewery Syndrome. Brewery Syndrome is a rare condition that affects the digestive system and can even make an individual act like a drunk. Now that's weird. This condition is traceable to the overgrowth of some yeast or bacteria in the gut. The thing is, when foods containing carbohydrates are eaten, these bacteria in the throat feast on the food and cause fermentation to take place. With fermentation at work, carbohydrates turn into alcohol and lead to a high rise in the level of alcohol in the blood, which in turn begins to make the affected person have symptoms similar to intoxication, plus other symptoms like dizziness and lack of coordination. It is almost impossible to live a normal life with this condition. I mean, how do you cope with a person acting drunk all the time?